Today is 3rd March, which is World Hearing Day, and we are celebrating World Hearing Week at our clinic in collaboration with WHO and Indian Speech Language and Hearing Association. My name is Dr. Tariq, and with me I have Shagun. She is my intern. So today we are going to tell you how an audiologist practice. An audiologist is a specialist who is helping you for your hearing loss, and he is responsible for the diagnosis, who works independently. Now me and Shagun are going to demonstrate how an audiologist works. First thing is, you can see my prescription pad, so I'll be taking a brief history or detailed history so that I can understand about the hearing loss, the nature of hearing loss. I'm going to conduct otoscopy. Otoscopy is the examination of outer ear, where I can understand if there is any presence of wax, and if there is any wax, we can get it managed. So this is the otoscope, and you can see in the screen, यहाँ पे आप देखिए, the shiny part is the eardrum. This is a clear ear canal, and this is how we are going to conduct the audio ear, and we'll be understanding about the status of the outer ear. Now I'm conducting a tympanometry, which is the test for the middle ear. So here in the otoscopy, I have tested the condition of I've seen the condition of the outer ear. Now I am going to see the condition of the middle ear, this is actually not a standard practice which has to be done, not a thumb rule, but this is something what I do. I evaluate outer ear, then I evaluate middle ear, then I check, I screen the hearing loss, can be what type of the hearing loss is that, and then we conduct audiometry, which is there in the audiometry room. So this is the probe of tympanometer, and here I am conducting, and you can see, those who are aware, you can maybe show on the screen. So those who are aware of the test procedure, they can understand. This is a type A tympanogram, which is an indicative of normal functioning of middle ear. Thank you, Shagun. Now this is tuning fork, and I will be conducting tuning fork test. The common two tests which are being done is Rene and Weber. So simply we vibrate the tuning fork. Can you hear this? And this one? Yes. Again I'll do it. This is 1 and this one is 2. Which one is louder? Easy one. The first one is louder. So this is an indication those who are into the practice of audiology, they can understand there is no such obstruction at the pathway at the level of outer ear or middle ear. Conducting Weber test. Do you hear the sound? Which side you are hearing it? Both the sides, which is an indication both the ears are having a similar hearing. So these are the after conducting all the tests, so this is the report what we are going to write. We can see the Rene findings coming out to be positive, 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 and the Weber is lateralizing towards both the sides at each tuning fork. Now we will be conducting PTA, and we have a separate audiogram, but again I am going to write it. So let's go for the PTA. This is the audiometry room, which is a sound treated room as per the standards. So I have a audiometer, which is a diagnostic 2-channel audiometer. Also we have some single channel audiometer. You can see this room as a sound treated room, which has been made so that there should be minimum interference of external noise. So patient is going to sit over here, and the examiner is going to sit on this chair, and this is also the bed for the electrophysiological test, which is BERA, ASSR, ECOG, WEM. So now we will be conducting audiometry test with this. So I'll be asking Shagun. Shagun, please come. And Shagun will be sitting as a client, and we will be conducting audiometry test for her. These are the pure tone audiometry headphones, and the instruction is you will be hearing some sounds. Whenever you hear, just press the button and indicate. Okay, so Shagun is I'll be asking you to remove the glasses first. Then she is made to wear the headphones like this, and whenever you hear the sound, just press the button. So now the client is sitting in that other room. I'm going to turn off the light so that she can get minimum clue. And now you can see on the audiogram, I'm going to present her with the tone, and whenever she hears the tone, she is going to indicate. And this is how I'm going to conduct the audiometry. After this, I will be conducting the speech audiometry. So you can see, Shagun, can you hear me? Whenever you hear, just raise your hand or press the button. Can you still hear me? Repeat some words after me. Sunset, blackboard, cowboy. So this is how we conduct speech audiometry, and after this we are going to conduct audiometry in the right ear and in the left ear, and based on that we are going to plot an audiogram. This is the air conduction. Now I will be showing how a bone conduction is. This is the bone conduction band. So this is going to be placed over the mastoid behind the ear. Shagun, please help me with this. So this is how we are going to place it. And also there is a term called masking, like when there is an asymmetrical hearing loss is more in one ear and the other ear is having better thresholds. In that case, we have to produce the sound, and we have a set of formula. Based on that formula, we do the masking. We have air conduction masking, we have bone conduction masking, and this is actually a little tedious process, but still we audiologists have to do this. So now I'm going to conduct bone conduction audiometry without doing masking. So there are the threshold or the finding what we get in air conduction and bone conduction. And as an audiologist, we must be knowing there is a term called air bone gap. It should be less than 10 so that we can understand there is no obstruction at the level of outer or middle ear. Please come, we'll be doing it. Now we have bone conduction, and you can see if she is going to respond. You can see she is responding whenever she is hearing the sound. I've reduced the volume and she is still hearing the sound, which is an indication that Shagun is hearing the sound through the bone conduction. So if there is a gap between the bone conduction is coming out to be at 10, 15, 20, and the air conduction, for example, is coming at 40, so there is a gap between the two, so that I can understand this is a conductive hearing loss, which is most probably a kind of hearing loss due to the obstruction. There is some infection at the level of outer ear, or there is some problem at the drum or in the middle ear. So after conducting Shagun's audiometry, so this is a dummy audiogram. So you can see this is the right ear, AC, BC, and again this is left ear, air conduction and bone conduction values, where we have the PTA values and speech audiometry values, and again the audiometric values. So here I have mentioned all the tests, and the findings are coming out to be normal. So if it is normal, just simply sign and don't just give it to patient, but also stamp your report, which is very important, which shows your name, your qualification, and also your license number, whatever you have. And if the patient is diagnosed with hearing loss, in that case you are supposed to manage it with the help of hearing aid. If the hearing aids are not helping you, you can do the management with the cochlear implant. And if you are finding if there is any hearing loss which is due to any obstruction at the level of middle ear or outer ear, or some infection or whatever it is there, which is not sensory neural hearing loss but a conductive or mixed hearing loss, send the patient to an ENT specialist, and then he is going to do the management with the medication or surgery. And again, if the hearing loss is still there, then they come to an audiologist for again the management with the hearing aid or cochlear implant. So in summary, Shagun is going to tell us what all we did.
So first we took the brief history, then we did the otoscopic examination of the outer ear, then we did the tympanometry of the middle ear, then we did some tuning fork test, and then we went for the PTA to do AC and BC and speech audiometry. We can even do masking if required according to the client.
So we recorded this video to create an awareness in general public, so that you can understand how an audiologist work, and what all are the procedures if you are going to an audiology clinic. So okay, so before we end the video, wishing you all happy
Happy World Hearing Day.